I am going to share this information with the general public, particularly those of my Nigerian community in Nigeria. First, as a disclaimer, this is a community service. This is not a medical advice to you as serving as your physician. I need you to, whatever information you get here, discuss that with your physician and act according to the advice of your physician with your consent. My name is Professor Ndubeze Okonkwo. I am a medical doctor. I'm a biochemist, an internal medicine specialist, a consultant in nephrology, and ultra specialty in solid organ transplantation, particularly kidneys and pancreas transplantation. Over the years, particularly within the last 5 to 10 years, I have witnessed this increasing sudden death among Nigerian men in Nigeria. Also, unnecessary death, a lot of which could be prevented by understanding very simple things and doing them. One of the disheartening things I've discovered is that we tend to listen to people in seeking advice on matters they don't know anything about. You don't take your car to a footballer or a school teacher to advise you on how to fix your car. You take your car to the mechanic. So when you are sick, you need to go to your doctors and be careful how you choose your doctors. All doctors are not the same. I'm not talking about intellect. I'm talking about skill. The skills come from training. They don't simply come from intellect. It doesn't matter how high your IQ is. If you have not seen a refrigerator before, when you see one, you will not recognize it. So there are reasons why we have subspecialties and specialties in medicine. Internal medicine alone has 14 specialties. And so does pediatrics. So you don't go to an endocrinologist when you have a heart disease. You go to a cardiologist. You don't go to a general practitioner when you have intestinal obstruction. You go to a surgeon, and so on and so forth. In order to take your health very serious, it is important to seek your advice from your healthcare providers and not from your friends or family members who recommend one thing or the other that the grandmother, the grandfather did 5 years ago, which may not have anything to do with what is going on with you today. One of my observations is that a lot of people that I know that have died, family members or friends, and my own family members and extended family members, I believe a lot of them die from complications of kidney diseases as well as heart diseases. In order to prevent this community service is essential. Please share with your friends and family members. Whenever you're having pressure on your chest, or you're having pain, or what may seem like indigestion, or when you're short of breath, when you feel dizzy, and they're persistent, it's not going away, you need to go to the hospital to be evaluated. don't circumguess what you think it is or what it may not be. Very often, if you are 35 years and above, it is heart-related, kidney-related, liver-related, and so on and so forth. Sometimes you can have blood clots coming from your legs going to your lungs and shutting down blood and oxygen supply, and then the person collapses and dies. So it is important for us to know that we have things that have been pointed by the medical community over many years that are called risk factors for heart disease or heart diseases, risk factors for heart attack, and risk factors for kidney failure, and etc. Most of the risk factors are very well known to us. One is diabetes, another is hypertension, another is high cholesterol, another one is smoking cigarettes, another is obesity, and there are many others. These 5 risk factors affect your brain. As when someone has a stroke, you will find that this individual most likely will have few of these risk factors. The same thing applies to heart attack, and the same thing applies to kidney attack. So in summary, if you have diabetes, if you have hypertension, if you're a man, and if you are 35 years and above, because being a man is a risk factor for heart attack, being 35 years and above is a risk factor for heart attack. So if you have hypertension, diabetes, high cholesterol, you're a man, and you're 35 years and above, you already have 5 risk factors. The chance of you developing heart attack, or having heart attack, or heart disease, stroke, or kidney failure is very high. Therefore, it is important that you start visiting your physicians very early to figure out how you can modify these risk factors. If you're a man, you can't change your sex. That's how you were made. If you're 35 years and above, you can't change your age. That is natural progression of life. Those are fixed things you can't do anything about. But the ones you can do things about, diabetes, hypertension, obesity, and others, that time will not allow us to mention all of them here. You can modify them. You can do something to reduce the risk of developing diabetes. You can do something to reduce the risk of developing hypertension and obesity. And if you already have them, you can control them by different modalities that a physician will prescribe to you. You treat the hypertension to control it to a normal level, control your diabetes to a normal level. Obesity can be controlled by exercise and diet, and by modifying the risk factors, you decrease the chance of you dying from these diseases. My observation in Nigeria is that very few people exercise. People eat whatever they want. Very few people worry about checking their blood pressure. So when I go on medical mission, I end up seeing young people with blood pressure up to 220 over 130, and they're not even aware that they have hypertension. People have diabetes without knowing it. Eventually they end up having the end organ damage. If it's not the kidney, it's the heart. If it's not the heart, it's at the brain, stroke. Or they can lose their legs. As you know, the commonest cause of losing your legs is diabetes. The commonest cause of losing your eye, going blind, is diabetes. So diabetes is very serious. And you can find out if you have diabetes or if you're done by a simple test. And the complications of diabetes, eventually, as I said earlier, will mount an aggressive attack on you, either through the heart or through the kidneys or through other organs, and eventually kills the individual. So when someone drops dead, it isn't necessary that that illness began on that day. It's something that has been going on over time. So as a community service, I'm recommending that family members, friends, encourage your friends and your family members to seek advice from their physicians. And the same way you take your car for maintenance, go to your doctors as frequent as your doctors recommend to you to ensure that you prevent these diseases before they get to a point where they will kill you. And then the preventive medicine will teach you to do the best you can to prevent the modifiable risk factors. And if you develop them already, to do the best you can to follow your physician recommendation to have them under control to minimize the mortality rate that we observe, people dropping dead every second. The 50 years of age, 55 years, 60 years of age, and we call it a transition to glory. And we gather and kill cows and celebrate and eat and say, this is how God wants it. No, it's not how God wants it. Here in the United States, we see the average lifespan is at least 25% more than it is in Nigeria. And there's no doubt about the linkage between lifestyle and death rate in whatever population you can examine.